Epistaxis is one of the most common otorhinolaryngological emergencies, characterized by nasal bleeding that can compromise the patient's hemodynamic stability. Although it is usually self-limiting, in certain cases it becomes a high-risk clinical event that requires immediate intervention and a deep understanding of the nasal vascular anatomy. Understanding the dynamics of the ethmoidal arteries, the sphenopalatine artery, and Kieselbach's area is essential to locate the bleeding site and apply precise control techniques that prevent serious complications. Specialization in this field provides professionals with advanced skills for diagnosing and treating anterior and posterior nasal hemorrhages. Proper management of nasal packing, cauterization, and surgical or endoscopic procedures requires precision, safety, and sound clinical judgment. Mastery of compression methods, correct use of vasoconstrictors, and identification of systemic causes, such as coagulopathies, hypertension, or anticoagulant treatments, are pillars of effective medical action in this emergency. This training represents a model of excellence in the comprehensive management of nasal hemorrhages, where science and clinical practice converge to ensure optimal results and preserve the patient's quality of life. Facing an epistaxis with knowledge, composure, and refined technique consolidates the specialist as a guarantor of safety and precision in the modern healthcare environment.